시청자 여러분 안녕하십니까? TVK에서 21세기 첨단의학 소개를 담당하고 있는 신경내과 전문의 전희택입니다. 오늘은 뇌신경 조절 치료법이라는 제목으로 현재 UCLA 대학병원 주은자 뇌신경센터의 원장이시며 정신과 주임 교수이신 앤드루 룩터 박사님을 소개하겠습니다. Thank you very much for coming over here, joining us, our medical talk show.
Oh, thank you for having me. I appreciate the invitation.
Why, you're always welcome. You know, last year about this time, I went to your seminar at the Century Plaza Hotel.
Yes.
That subject was neuromodulation.
Yes.
And it was met with great appreciation, and a lot of doctors were very happy, and I thought it was remarkable. Wanted you invite to this show so that we can show it to our audience. So let me just ask you, starting with the question, what is neuromodulation?
Okay, it's an excellent question. The most common Western approach to treating psychiatric and neurologic illnesses is to use medications.
Correct.
And many of these medications work well. For example, for depression,
right.
About half the patients who we treat with one antidepressant medication will
right.
get much better.
Right.
The problem is that medications don't help everybody,
right.
and it can take a very long time for these medicines to work.
Correct.
Additionally, the side effects can be a problem.
Right.
Stomach upset, dizziness, lots of different issues.
Right. I noticed lately, past 5-10 years, I've retired from practicing neurology about 2 years ago. There seem to be a lot of excellent medications, especially for the MDD, major depressive disorder. And like you said, one of the problems were side effects such as severe drowsiness, sedation. But I noticed the medication works great with the depression. So this new neuromodulation, as I understand, is kind of a physiological process, but you're using something other than classic neuronal transmission.
That's exactly right. What we do with neuromodulation treatments is we have a few different devices that we use to introduce energy into the brain. We pulse the brain with magnetic waves, sometimes with very small amounts of electricity. And what this energy does is it resets the brain networks.
Okay.
You know, the brain, as you know, is a very large network. And in major depression and other illnesses, the network is not working properly. What we find is that with one of the more common treatments we use, which is transcranial magnetic stimulation, or TMS.
TMS. Transcranial magnetic stimulation.
Correct.
So you must be using magnetic power.
Yes, we use an electromagnet to pulse the brain with magnetic waves. And we find that if we do this daily for about 6 weeks, that many patients who have not benefited from medication can recover from their depression using this technique.
And no severe side effects like sedations and drowsiness like you could expect from the medication?
It is a remarkably safe and effective treatment with very few side effects.
I see.
The major side effect that people tell us about is that when the electromagnet is pulsing the brain, sometimes they can get a little bit of a headache.
How strong is this magnetic field, the force of magnetic power?
Okay. For those of you, your viewers who have had an MRI, this is about
that uses magnetic force, right?
Yes, that uses magnetic
is it similar
energy.
kind of power?
It is. It's the TMS machine we use for treatment is much smaller than an MRI, but the strength of the magnet is about the same. The difference is that for this, we use an electromagnet like this one here.
Okay.
Just we put it on the side of the head.
You brought the actual device today.
Yes, I did.
So this is electromagnetic equipment. In
Yes.
other words, you have to plug this to have the magnetic power. Is that correct?
Correct.
Can you show us where is the plug and which part goes to your body?
Sure, be happy to. So this is the electromagnet itself.
Okay.
And this is the other end of the
Okay,
plug.
you have to plug into the electrical socket.
This has to go into the machine. I also brought a picture of the machine. But what we do when we treat the patient is we take this magnet like this, and this is the side that we place along the patient's head.
That actually goes near your head?
Yes. It goes up on the side of the head,
but
much like this.
You're not pressing it down with the machine?
No, the machine helps hold it in place.
Okay.
it's rather heavy because it's
so
a large
you have like a helmet covering your head with this?
It's a small arm that holds the magnet in place.
Okay.
And then it just sits like this toward the side of the head.
Okay, near your head.
Near the head.
So it's not like an MRI, your body doesn't go into the tunnel.
Correct. You're actually sitting in a chair the whole time. You can be sitting in the chair. In fact, I brought a picture of the device here. So you can see the
I see that chair. You can reclining down very comfortably.
Yeah, there are several different manufacturers that make these devices. This is one particular device made by a company called Neuronetics, but there are others.
So you have to go through this every day for 6 days a week for how long?
5 days a week for 6 weeks.
Okay, 5 days a week, 6 weeks. Okay.
And what we find is that many patients
How
who
long
do
does
this,
it take one treatment?
Each treatment session takes about 40 minutes.
40 minutes, okay.
Sometimes we expand the treatment session to make the treatments more effective. We make them a little bit longer.
I see.
There also are a few different places on the head where we can stimulate.
So a patient should sit still, or they can read a book or newspapers for 30 minutes?
That's an excellent question. The patient is sitting in the chair, leaning back with the magnet on their head. Okay. They can read a book. They can have a friend with them, talk with their friend.
They could even talk, okay.
And actually, we have a television set, so they can watch whatever movie they would like on Netflix.
So it's a very comfortable treatment.
Very comfortable. In fact, a lot of people find it rather relaxing to take a break from the day and get treated and watch some television or read a book.
So you don't have side effects from taking strong antidepressant drugs, and you use this without any medications, is that correct?
Well, patients can be on medications while they have this treatment. If somebody's on medication and has gotten some benefit, they can stay on the medication while they get this.
I see.
Like every treatment, it does have side effects. As I mentioned, the most common side effect is a little bit of headache. Some patients in the first few treatments complain that they're a little tired, but that usually passes.
I see.
There is a very rare occurrence of seizures with this.
Well, that could expect from any treatment for the depressive disorders.
Yes,
So,
anytime you stimulate the brain, there's a risk of seizure.
right.
We have never had one in our practice.
So some patients could get off the medication and just to try this method of treatment?
Yes, it's generally recommended as something to add on to medication.
But not strong enough to have the side effects.
Right. There are many patients who come to us, they say, I've got medication side effects, I don't want to take the medication anymore.
Okay.
Can I have this instead?
Uh-huh.
And that's some of the patients
All right.
who we treat. And some of the patients who come to us on medication, when they get well, they can lower the dose of the medicine and still remain well.
So you continue to take their medication in lower dosage, and you go
Right.
through this daily treatment for 6 times a week, very comfortably, reading newspapers, right?
Right.
Very good.
Or
So
watching Korean television.
Is that right?
Yes.
K-pop too?
Yes.
Okay. So this is one of the recent development in the neuropsychiatric treatment, where brain becomes interface with the machine, especially the computer. You call that brain-computer interface or something
Correct.
like that.
Mhm.
So this is one of the BCI then, is that right?
Yeah, this is one of the neuromodulation techniques. This one is the major one that is approved by the FDA for the treatment of depression. And it's a very good treatment. One of the inconvenient things about it is that you have to go to a doctor's office 5 days a week in order to get the treatment for the 6 weeks. We have other kinds of treatments that we're developing that could be used by the patient in their home more conveniently, and those we're doing research on those to prove that they are safe and effective, and hopefully one day soon those also will be available.
I see. So this is one of the neuromodulations, but there are other type of modulations as well. Is that right?
That is correct.
Like
yes.
Stimulating one particular nerve, like a trigeminal nerve, you could have some degree of antidepressive effect. Is
That's
that right?
correct. Yes. Yeah, and I brought one of those devices with me here.
Okay.
This is one that we're doing research with now.
Okay.
For this is TMS, transcranial magnetic stimulation. This is TNS, trigeminal nerve stimulation.
Trigeminal nerve stimulation.
Yes.
Okay.
So the trigeminal nerve is a nerve that comes from the face that goes directly into the brain.
Right.
There's a very large part of it here in the forehead. And what we find is that we can place this very small patch on a patient's forehead, just place it like so here, plug these wires into this stimulator here, which is very simple. It's about the size of a deck of cards, powered by a 9-volt battery. Battery
operated.
Exactly. So there's really no significant risk to this.
I heard about the over-the-counter gadget called Fisher-Wallace stimulator. Is that the kind of trigeminal nerve stimulator?
No, the Fisher-Wallace stimulator is something very different. That's what we call transcranial direct current stimulation, or TDCS, where you're basically placing an electrical charge across the head.
Very low level electrical charges.
Very low level, no risk of seizure again. And it's not very well understood what that stimulator does, or what some of the other stimulators do. It looked like a headband
over your forehead, and it's a battery operated. And they say you could buy that with the nurse's prescriptions or therapist prescriptions.
Yes.
So it appears very simple gadget, and so it doesn't really stimulate the trigeminal nerve, but it's more generalized application of mild degree of magnetic power or just electrical power?
Yeah, it's a very, very low level of electrical current.
I see.
And those stimulators like that you can buy on the internet.
I see.
They're not very highly regulated.
Right.
Some of them, like the Fisher-Wallace stimulator, you need a medical professional to recommend the use of it. And there are small sponges that you soak in water, place on the
So
on
this
the head.
stimulator is more specific. You're stimulating the trigeminal nerve directly, and it could be used a more precise way and much better result, I guess. So far, what other results you get?
Right. So we have published studies. We're building a strong base of evidence for that this works. There are published studies suggesting that it's very good for epilepsy, control of seizures. We've published studies in major depressive disorder.
You already published a controlled study, a double-blind controlled study?
We published only small studies at this point, so we need to do larger studies to prove that it works. That is, I think, the challenge for all of these technologies. This technology, the TMS, is very well proven.
And already FDA approved.
Correct.
Yeah.
And these other techniques, we need to better understand and prove that they work. We're now doing a large, double-blind, controlled study at the Veterans Hospital in West Los Angeles, studying this technique for post-traumatic stress disorder, PTSD, in veterans who have experienced PTSD from combat.
I see.
And thus far, we're very encouraged that this seems to be helpful in relieving some of the major symptoms of PTSD, like sleep problems, anxiety, nightmares, depression. So it looks like it has the promise to be an effective treatment.
Excellent. So how do you use this? Is it daily use, or how long? What is the duration of the actual treatment?
Yeah, it's an excellent question. This is a particularly simple device to use. What we instruct our subjects is that when they're ready to go to bed, the time they would normally go to bed, we ask them to put the patch on their forehead, plug it into the device, turn the device on, and then just go to bed.
I see.
So they wear this for 8 hours at night while they're sleeping.
Oh, treating while you're sleeping.
Exactly. What could be simpler than that?
And you wake up without any depression. Is that right?
Well, we do find that many of the people in our studies have had substantial benefit for depression, anxiety, PTSD, sleep problems after just a very few weeks of treatment. And because this is very safe, they can continue to use it, and they can use it in their home, which makes it much more convenient.
It's more or less like a portable treatment. You carry in your pocket, and you can use it anytime you want to.
Right, right. It's very easy to use, and all you need is this small device, the patch, and a 9-volt battery.
And this is battery operated.
Correct, yes.
Amazing.
So we have a number of treatments, ranging from ones that we use in the office that have to be administered by a physician, to ones that a physician can prescribe and the patient can use at home. And we are developing more of these kinds of treatments that are an alternative to medications that use energy to treat illness rather than taking a pill.
Right. So this is a non-invasive neuromodulation.
Correct.
There are also entities called invasive neuromodulations, right?
Correct, yes.
What is the major example of invasive neuromodulation?
Right. So the major technique that is used, that is being researched these days, and it is also being used clinically for some illnesses, is deep brain stimulation, or DBS.
Correct.
There are a lot of letters for all these techniques. So for DBS, What the surgeon does is to create a small hole into the skull and pass wires into the brain into a specific target.
Correct.
And
Inside the brain.
yes. Mm-hmm.
Right.
So, for example, for Parkinson's disease,
Right.
if you want to treat the tremors and the problems with movement with Parkinson's,
Right.
you pass the wires deep into the brain, and then by attaching those wires to a small stimulator, which the patient commonly has implanted in their chest.
Just like a pacemaker.
Exactly.
And the implant you put inside the brain is tiny little electronic implant. Is that correct?
It's a tiny wire about the thickness of a human hair, so
Right.
it's very small.
So I hear that they do this surgery while patient is half conscious, so that they could locate the wire, the exact place where they want to control that particular tremors.
Correct. Yes, there are, as you know, there are no pain sensors in the brain.
Correct.
So once you're putting the wire into the brain, the patient really can't feel anything, so
Right.
they can be awake. And as you say, you can place the wire in the best location
You can
to
guide
benefit
it
that patient.
exactly what location that brain cell is controlling your tremors, whether it's your fingers or it's in your arms or precise location.
That's correct. You can place the wire, turn on the stimulator, and see what location suppresses the tremor, makes it easier for the patient to move. And when we say to patients, you'll be awake during the procedure, they can be kind of nervous about that. But it is done all the time, and it's very safe.
So it's a very safe surgery, even though it opens your skull, but very mild sedation and easily arousable sedation, and obviously not a major complications from that.
Well, because it is more invasive, because it is brain surgery,
Of course.
it is reserved for patients who are either no longer benefiting from medication or whose symptoms have gotten
Right.
so severe that they
Disability
need
is
something.
so severe that you need the more invasive treatment.
Correct, yes.
I see.
Mhm.
So, what other either invasive or non-invasive modulations you doing these days?
Right. There are several different techniques that are in development. You know, what we're finding is that there are many benefits to stimulating the brain directly. So any kind of energy that one could use, if it's electrical energy, if it's magnetic energy, you can even use ultrasound. You can use sound waves, very high frequency, and to put those into the brain, and they can reach
So
deeper.
ultrasound stimulations in certain part of the brain, and you observe what kind of results you get from the ultrasound stimulation.
Yes, and one of the advantages of ultrasound is, you know, the magnetic waves are very powerful, but they can only penetrate a maximum of 4 to 6 centimeters into the brain. Ultrasound can go much deeper.
I see.
So we can stimulate other targets that we otherwise couldn't get to very easily. So ultrasound, infrared energy, lots of different ways to try to stimulate the brain. And if you can find the right target, you can help reset the brain network, how the brain processes information, and help somebody recover
Right.
from their illnesses. And these techniques are now being used for depression, PTSD, Parkinson's, epilepsy, also chronic pain.
Right. Well, I just heard about botulinum toxin
Yes.
can be used for the stimulation for severe and uncontrolled bladder urgencies, especially ladies with the urgency incontinence.
Right.
They're using botulinum toxins. Have you heard about that?
Yeah, the botulism toxin, it's something that we used to be very scared of.
Right.
Because it can
paralyze you.
It can lead to death. But in low doses, carefully controlled by a physician, it's now being used for urinary problems. It's being used very successfully for migraine. I have several patients.
So you have to implant that into the spinal cord then, the botulinum toxins?
Actually, for migraine, it's interesting. You just inject it into the forehead.
For migraine?
For migraine.
If you're treating your bladder incontinence, you have to stimulate the spinal cord.
Yeah, that's an area that I generally don't deal with.
You don't deal with that. But, it sounds like we're going back to 1950s with the electric shock therapy or electroconvulsive therapy, and as well as insulin therapy. It make people have convulsions, and then you try to treat the seizure disorders or severe psychosis like schizophrenia.
Right.
In old days, you remember that? I'm sure when you worked at the VA hospital was I remember there was 3 times bigger hospital buildings for the psychotic patients, where they called Brentwood Mental Hospital.
Right, right. Yes, it was the place during World War II where a lot of the psychiatric casualties, which were many from the war, would come. And it's, ECT, electroconvulsive therapy, where we pass electricity into the brain to cause a seizure, is still in use.
I see.
It is actually very effective for depression. It has some side effects that many patients find troublesome, though. You can become confused, have memory loss. It can be difficult to function day to day while you're having the treatment.
I remember, I did my internship in early 1970s, and a lot of psychiatrists were so impressed with the electroconvulsive therapy. You cause convulsions for the schizophrenic patient, and they get good results for at least several weeks or something.
Yeah, it is still one of the single most effective treatments we have for depression.
Is that right?
That, in fact, was part of the inspiration. The idea for TMS came from ECT. People said, oh, well, we're using electricity to stimulate the brain. Why can't we use magnetic energy instead to stimulate the brain? And what we find is that TMS is giving very good results, but you don't have to actually pass electricity into the brain, and you don't have to cause a seizure. Whereas with ECT, the benefit seems to come from causing the seizure.
Right.
With TMS, the whole point is not to cause a seizure.
Yeah, in the old days we treated the whole body, the whole system. Now you just treat the portion of the nervous system, and you get the same result.
Yeah, this is a much more specific, targeted treatment. We pick a particular area in the brain that regulates mood, apply the energy just to that. But when we focus on one area, the signal still spreads throughout the brain.
So it's more targeted, and it's more simplified and harmless procedure. Is that correct?
Yes, it has a very favorable side effect profile. Patients tolerate it very well. They say, rather than having confusion or memory loss, actually many patients say their memory is better, their thinking is clearer when they're getting TMS.
So you are controlling the human system with either electricity or magnetic power or even ultrasound. So the human body used to have only few chemical neurotransmitters in order to have the specific activities like serotonin for the nervous system and acetylcholine for Alzheimer's disease, and what else? What are the neurotransmitters like norepinephrine and endorphin,
dopamine for Parkinson's.
Right. But now we're using the external gadgets like electricity, electronic wire. So is it? Are we coming to close? Brain and computer working together and reaching the goal we wanted to create in the past?
Yes. I mean, it's very interesting how we're moving from using chemicals to using energy now. The drugs that we have work on individual nerve cells to release neurochemicals to stimulate one cell. The neuromodulation techniques now stimulate a whole group of cells in a particular part of the brain. And those signals then spread to other parts of the brain and start to affect the same chemicals. They affect the same cells, but they do it through energy, not through molecules, not through drugs.
So it's much more precise, and it looks like brain and the computer is coming together very quick, and I think I have to invite you again and talk about brain-computer interface, BCI. Thank you very much for coming over.
Oh, it is my pleasure, Dr. Jeon. Thank you for having me.
시청자 여러분, 오늘의 의학 정보가 많은 도움이 되셨으리라 믿습니다. 자세한 것은 주치의와 상의해 주시기 바라며 오늘은 이만 줄이겠습니다. 감사합니다.